Okay, we should be good now.
Okay, I would ask that we call this special meeting of the Woodford County School Board to order. There are 4 board members present, and Ms. Evelyn is making efforts to join, having some technical difficulties, but we didn't want to make anyone wait. So we will go ahead and start the meeting. Mr. Hawkins, if you would like to take over from here.
All right, thank you, Ms. Bradley. Thanks for everybody who is tuning in. It's a great opportunity for us to talk through the reentry plans that we have developed and also be able to address a number of questions. I think it almost goes without saying, but I think it's important to say that this is the most challenging situation that we have ever faced, and that things are changing almost daily as it relates to the circumstances that we face with the coronavirus pandemic. As we have gone through our planning process, we have kept 2 key factors at the forefront of our planning. And the first is the health, safety, and wellness of our students and staff. And the second is the academic needs of our students. And I think it's important to note that there is no perfect re-entry model. However, as we have put together this plan, our recommendation is based on what we believe best addresses those 2 key factors. And again, our recommendation will be the dual system. And part of that is because every family situation is very unique right now. And we felt it was extremely important to give parents a choice as to what best meets their needs and the needs of their children. Even to the point that if parents have multiple kids, they can choose different options for each child. So if they feel that one is more apt to do well virtually, that's okay. And if the other one needs to go in person, that's fine as well. So again, we just felt like that was extremely important and was a big part of the models that we developed. I think it's also important to note that the planning that will be taking place between now and our first day of school is essential. And it's critical, particularly for the dual system. We will be finalizing some planning days later on this week as our task force reconvenes to look at those supports and trainings that are necessary to help begin next school year. I think we also have to recognize that things will continue to change, and we have to be ready to adapt to those changes. As we go through tonight, the plan that we will be going through is on the website. So I'm not going to go in great detail through the finer points of the plan. Again, I think you will understand how our plan will work based on how we respond to the many questions that we have this evening. And we want to devote as much time as we can to answer those questions. I think a couple things that I would like to point out is that depending on the decision made by the board later this evening, it will be much easier to go from a dual system to an all virtual if things were to change between now and August 26th. If we were to choose all virtual and then try to decide to go to in-person, if that's not done before the end of July, we would not have adequate time in order to plan accordingly. So again, I think that is an important point to make. I think the other thing too is that the all virtual model is a long-term commitment because the online platform that we will be utilizing is self-paced. if we were to make an adjustment going from all virtual to in-person during the semester, we will have students at a wide range of places in the curriculum, depending on how they have moved through and progressed through the content. So I think if we were to look at all virtual, it would almost need to be a full first semester commitment to make that transition smoother for our students and for our staff. I think the last point I would like to make is that if the all virtual is selected, it may require the high school to adjust their schedule. I think we saw very clearly that trying to maintain a full 8-class schedule virtually is extremely difficult on the students. And so, again, they would need to have some time to be able to make those adjustments. Again, we want to devote as much time as we can to answering the questions. I want to thank all those who submitted questions. We certainly appreciate your passion and your interest in not only your children, but in our school district. And so I think we've got about 118 questions that we're going to go through this evening. And what we will do is that Miss Bailey will read the questions, and we have divvied up the responses, and we will be going through those to answer those as efficiently and as thoroughly as we possibly can. So, Miss Bailey,
Ready?
we'll turn it over to you.
Okay. First, is it mandatory that a student wears a mask in school except for medical reasons and pre-kindergarten and kindergarten students?
Yes, it is mandatory when 6 feet of social distance cannot be maintained.
If we choose virtual, will the kids have a Woodford County teacher, or will it be teachers from our child-specific school?
WCPS teachers will be supporting students using Edgenuity or Odysseyware as the core curriculum. It may or may not be a teacher from your child's school at the elementary level.
With the increase in cases as we move forward, do you think teachers may be changing their minds about returning to the classroom? They will be the ones at greatest risk. Do you feel they have been given a fair opportunity to express their concerns anonymously?
So we have surveyed our staff twice. The second one was an anonymous survey. The percentage of staff that wanted to return to in-person actually increased on the second survey. But we will ask them one more time. The first 2 surveys were more of a big picture broad to kind of find out where our staff are at, but we will survey them specifically one more time to find out, as we have a reentry plan, to find out what their intentions are.
How will it be addressed if a child will not wear a mask, keeps taking it off, or forgets their mask at home?
So we'll deal with that like any other classroom type disruption. We'll work with the family. We'll provide the student a mask, but it will be a part of our PBIS expectations in the school.
Will the online option be personalized for their academic level, or will the entire grade level be receiving the same assignments?
It will be the same base core instruction across the grade level. However, there will be opportunities for extensions and remediations to meet students' needs.
What will happen to staff if the majority of families choose virtual?
We will simply just have to, staff will be allocated accordingly to adjust to those numbers.
Who is responsible for enforcing mask wearing and other safety measures in schools? How do you plan on empowering these individuals and setting the tone for the school year that COVID-19 is a real threat and that adherence to safety measures are necessary?
Yeah, so our school staff will be responsible for enforcing that expectation, and again, it will be included in our PBIS structures in the schools.
Will the online option keep my student maintaining the advanced track and schedule so that upon returning, my student will not have missed anything and not advance in the upper level classes?
Yes, in middle and high school, we will be able to place them in an advanced course for math and or language arts through Edgenuity. For example, we would assign a 7th grade student to 8th grade math through Edgenuity if that's the appropriate progression for that student. Science and social studies would most likely be consistent for the grade level, again, with acceleration and enrichment opportunities incorporated as needed.
What additional staff or faculty trainings have been held or are planned to be held specifically related to education in the time of the pandemic?
Multiple professional learning opportunities and trainings are scheduled over the next month, over a month, to plan for the upcoming school year.
Are there guidelines for the types of masks that are to be worn? Can students wear bandanas or the face masks that go around your face and neck? Is there a certain ply, for example, 2-ply, 3-ply?
So our students will be able to wear cloth masks, surgical masks, or what are called the gator masks. And so we'll provide some additional information in those areas. We'll provide some pictures once our reentry plan is decided upon.
How will IEPs work? I have one student with speech needs that needs one-on-one time. I have another with severe ADHD that when he gets overwhelmed, he goes to the office to work or to a room by himself with an aide to also have one-on-one time. How will students that have IEPs and 504 plans receive what they need if they cannot leave the classroom?
We will implement the child's individual plans while following the Healthy at School guidelines.
What is the name of the virtual academy platform?
It's called Edgenuity for middle and high school, and Odysseyware for elementary, although Odysseyware is under the Edgenuity umbrella.
Will teachers receive their duty-free lunch if kids are eating in the classrooms?
Our goal is to utilize the cafeteria for lunch. The cafeteria size allows for greater social distance opportunities as opposed to a classroom. There will be seating charts in the cafeteria should contact tracing be necessary. This also will provide our teachers with the mandated duty-free lunch.
Will wearing a mask become part of the dress code policy?
Yeah, so anything on the mask will be part of the dress code. So for example, if it's inappropriate to have on a t-shirt, it will also be inappropriate to have on a mask.
If a student needs help virtually, are there teachers available to help?
Yes, certainly. The assigned virtual teacher will be able to provide that instructional support.
How will Woodford County teachers be assigned, especially at the middle school level? Will a 7th grade math teacher be teaching a 7th grade math class? Will a 2nd grade Southside teacher still be teaching a 2nd grade Southside class?
Teachers will be assigned to the grade level in courses based on the results of the virtual and in-person options that are selected by parents.
How are you planning to implement mask breaks into the day?
So we understand mask breaks are important and they're necessary, and so we're going to work with the health department to develop a plan for the mask breaks.
Will students need to log in at certain time frames daily?
Yes, they will. We've outlined that there's going to be daily interactions for our elementary and middle school, and high school will be a minimum of 2 times per week. The teachers assigned to the virtual academy classes that we've been talking about, they will coordinate those individual, small group, or whole class meetings during the school day and across a week.
Will there be extra staff employed to help teachers enforce the mask and hand washing rules in the classroom? Teachers already spend a lot of instructional time on behavioral issues in the elementary classrooms, especially at the lower grade levels. And enforcing these new guidelines seems like it will cut into instructional time considerably.
That determination will be made once we get closer to the school year after finalizing our staffing plan.
Are there enough Chromebooks for every student in our county if a mandated quarantine is put in place again?
Yes, we have quite a few Chromebooks, so yes, there are.
Have you considered plexiglass face shields for teachers so that students could better hear and see them during in-person classes?
Face shields are not acceptable based on the Healthy at School guidance.
Will the time commitment for the virtual academy be similar to in-person school?
Yes, we estimate that it will, but that will vary depending on the student's independent pacing through their lessons and assignments.
How far in advance to the start of school will parents have to make the decision of which option is best for them? Will there be a cutoff date that a family cannot change their decision?
We will be seeking that information from parents as soon as possible after the board makes a decision. If a parent has chosen in person and later opts to go virtual, that can happen at any time. However, once virtual is selected, that cannot be changed until the time frame that is outlined within the plan. So elementary would be at a scheduled break, middle and high would be at the semester break.
How will we ensure everyone has appropriate PPE? How will you enforce wearing PPE?
So our district health coordinator is working with school staff to order the necessary equipment.
How will parents receive feedback to ensure assignments are being completed?
And this is targeted toward the virtual academy. So primarily the virtual teachers will keep them updated on their progress, but parents will also be able to view just via the student portal, and there's also parent portals available through both programs.
What about the parents that don't have internet, especially if a mandatory quarantine is put in place? Will paper packets be an option?
We will work with the families who may have internet needs.
Before school begins, will we know how many students are going to be attending in person? How many students will be in each class, and if they will be able to distance their desks 6 feet apart? Some may choose to keep their children home if they cannot be distanced and able to take off masks at their desk, even if they choose the in-person option.
Once we get the registration feedback from our parents and they make their selections, then schools will be communicating class numbers once all that has been completed, much like they do now.
What happens when there is a positive case at school? Will only that class be quarantined? Will the entire school be quarantined since they are all in the same building? How will parents be notified if there is a positive case at the school, but may not have occurred in their child's classroom? What procedures are set in place when there is a positive case or a direct contact with a positive case at the school?
So the health department will notify us when there's a positive case, and we will work with them through the contact tracing protocols.
Do you want to explain what that is?
So, just want to read off the
Yeah.
paragraph.
So you just tell us, we've received this from our health.
So we received some information from the health department to kind of describe the contact protocols, and so real briefly I'll read that to you. So upon receipt of a positive COVID-19 case, the Woodford County Health Department or Kentucky Department of Public Health contact tracer will make contact with all individuals deemed as a close contact by a disease investigator. The close contacts will be required to self-isolate for a period of 14 days, beginning the last day of exposure to the positive patient. A negative COVID test is recommended for all close contacts before returning to work or school, but is not required.
Will assignments and grades for the virtual academy be posted in Infinite Campus?
The assignments will be posted through Edgenuity for our secondary levels and through Odysseyware for elementary, but the grades, those will be posted in IC as normal.
I understand that you and your planning team have deemed a hybrid model unfeasible. With the rising numbers of cases nationally, with confirmed case numbers exceeding those in March and April, how can it be safe to resume a normal school schedule now when it was not then?
Well, obviously we know much more about the virus today than we did when it first hit in February and March. And just as businesses have followed state guidance as they have reopened, we are following the Healthy at School guidelines that have been established for us from the governor and the State Department of Health.
Once the decision is made about what options are available, how will we sign up for the beginning of the school year?
So we'll send an electronic form via Infinite Campus to all of our families, and then we'll follow up with a phone call to families who do not return the email.
How will the parent sick note policy be updated?
So our goal is not to change the policy, but rather we want to work with families individually should there be a quarantine or a COVID-19 issue.
Will there be specials, music, art, etc.? What about electives for middle school and high school, and fine arts for the elementary?
Well, for our secondary levels, there are several foreign language opportunities and career exploration courses offered in Edgenuity. But overall, in addition, we continue to be committed to offering arts and humanities to all levels, including elementary. But those plans, we're still working out the details, and those plans are still under consideration.
Besides custodial staff, what will teachers have available to clean surfaces in the classroom as needed, since disinfecting wipes and sprays are impossible to find right now?
We've already placed multiple orders for the necessary supplies, and we will continue to make those orders as they are necessary.
Have you all considered that students could come back from quarantine and then get re-exposed once coming back to school and then be sent back home for another quarantine? Isn't it possible that students could be quarantined over and over?
Yes, it is a possibility.
In order for someone to switch from online to in-person, will there have to be room for them in the class, or can they come no matter what?
This will be evaluated at the breaks in the school calendar as we've outlined in the reentry option plan. The current health guidelines will also have to be considered at those times.
How will desks be cleaned between classes in the middle school and high school?
So our teachers, students, and all staff will be expected to clean specific areas and spaces. For example, we would expect students to wipe down their assigned desk prior to leaving the room. It's impossible for our custodians to clean all classrooms between classes.
Will every child have their own Chromebook?
As they usually do, grades 6 through 12, yes. If an elementary student needs a Chromebook, one will be provided.
If my child runs a fever, will he be required to take the COVID test in order to return to school?
So they would be required to be fever-free for 72 hours without fever-reducing medication.
Is Woodford County Schools willing to reconsider the platform and curriculum for the virtual academy?
Here in Woodford, we have used several online curriculum platforms in the past. Edgenuity, which has been used for several years, has proven to be a high-quality program to meet students' needs. And then Odyssey, as I've mentioned, Odysseyware is the elementary option provided by Edgenuity.
What about special classes, speech classes, and gifted, talented classes?
Students' individualized plans will be implemented whether students attend virtually or in person.
If my child is suspected to be ill, will he be required to begin virtual learning?
No, the typical instance would be a transfer to home hospital instruction for an extended absence.
How will virtual classes be split up in regards to level, low, average, advanced?
They will not be split up. It will be the same base core instruction across a grade level. But as I've mentioned, there will be opportunities for extensions and remediations to meet those students' needs. Has increasing time outdoors and in recess time been considered? Why or why not? It has, and we'll rely on our schools to make the determination regarding what instructional lessons can be taught outside, in addition to their scheduled recess time. I must ask, what metric is WCPS using to make the decision regarding safety?
So we are following the Healthy at School guidelines provided to us by the governor and the Department of Health.
How many children will be allowed on a bus?
We will be allowed to have a maximum of 2 per seat on the bus, with students being in mask, except for our pre-K and K.
What does it mean to be mostly internet-based?
There may and likely will be instances where a teacher meets with students in small groups virtually to provide further learning beyond what the online platform provides using books or other tangible resources. Learning will still be provided via the internet, just not the online learning platform of Edgenuity or Odysseyware at all times.
Has dividing children's classroom time so that only half of the students are in the classroom at a time been considered? Why or why not?
Yes, it has been considered, but the challenges it presents both academically and logistically do not make it a viable option.
Will kindergarten class desks be 6 feet apart since they are not required to wear masks?
That will depend on the number of students in the classroom.
Why weren't all parents called on the automated line you use to communicate with parents to be notified of surveys, meetings, and all other information regarding the reopening of our children's school year? Why are you relying on social media to communicate to parents?
We will certainly utilize the one-call system to notify parents of the survey that will be sent out asking for their decision. And we will continue to use all other communication outlets that we have as a school district. But yes, the one-call system will be utilized for this moving forward.
How are students graded? Who is administering their tests? How is the progress of the student being monitored?
Students will receive grades based on their progress through Edgenuity or Odysseyware, as well as any additional assignments assigned by the virtual teacher. As far as tests and quizzes, those are part of the platforms and will be monitored by the teacher.
What is the maximum number of students that will be in each classroom by grade level?
Until we get feedback from our parents in terms of the choices that they make, this is yet to be determined.
Will hand sanitizer be readily available for students to use, including kindergarten students?
Yes.
For elementary age students, especially our younger students, how is reading and writing being evaluated?
I described this a few questions ago, but we intend to do this through virtual learning. There may be instances where the teacher meets with small groups or even individual students to assess beyond what the online platform provides. Again, using books or other tangible resources.
Will there be different bus schedules? Do we have enough buses and or drivers to accommodate getting all the students to school while following the social distancing rules?
We can always use additional bus drivers, but the final transportation routes and the number of buses needed, that will be determined by the responses from our parents. So in terms of if they're returning to school and do they need transportation, morning or afternoon.
Will students at the elementary level be divided evenly between classes and teachers? Say there are many less kindergarten students who choose to come to school in person, but most of the third graders come in person. Will there be more third grade classes to help spread students out evenly through the building?
Very simply, staffing will be determined by those families' responses, by their choice.
What expert epidemiologists beyond state and local health officials did you and or your cabinet consult in developing the reopening plans? Did you and or your cabinet attend any webinars or other trainings presented by leading experts on COVID-19 in order to gain a fuller understanding of disease transmission, risk factors, and emerging science? If so, will you provide information about those trainings and consultations?
So we have worked with our state and local health officials as we develop our plans that we propose. We have attended weekly webinars through the Kentucky Department of Education that oftentimes they do include health officials. And we've also been in contact with a local pediatrician who's offered to advise us through the reentry process.
Is there a parent portal where parents can assess their kids' work and progress?
Yes, parent portals are available in both Edgenuity and Odysseyware, and then in addition, we do plan to have opportunities for the parents and families to have trainings about the virtual learning, and that will be provided in several platforms.
Have you or your cabinet looked at reporting from other nations as they reopen their schools? Schools operate on different schedules internationally, allowing comparisons that are not possible within the U.S.
We do receive weekly information from our state and local health officials, as well as the Department of Education, and their guidance is updated on a regular basis. Also, our newest member of our administrative team worked last year in South Korea, and so he has been able to provide some information on how they re-entered school and has shared some information with us as well.
Does the current Woodford County plan build in any additional safety measures beyond the minimum state guidelines for school reentry? Can you specify any areas where you have exceeded state guidelines and gone the extra mile?
So the current guidelines and the Healthy at School information we've been given, they're very extensive and very intentional. Some of the additional steps we've taken, we are planning to hire additional bus monitors to help with health and safety procedures on the bus. And we've also purchased temperature scanning equipment to improve efficiency of the student arrival process.
Will kindergarten students be required to use a Chromebook?
If virtual learning is taking place, then yes, a device will be necessary.
How easy is it to switch back and forth between in-person and virtual in regards to content?
So the plan is that teachers are working to identify essential standards that will be taught both in person and the virtual setting. Edgenuity and Odysseyware both offer course customization to allow for students to learn content in the same sequence as the in-person instruction.
Will car rider drop-off times and locations be staggered to help decrease the number of students entering the building at one time?
Each school will be tasked with determining their plan for drop-off, but the times for drop-off will likely not change.
What safety measures would you like to be able to implement but cannot given the limitations you have encountered?
We would like to be able to ensure 6 feet of social distancing at all times, but unfortunately schools were not designed in this fashion. And so we are trying to maximize the available space to allow as much distancing as possible.
If a student is not doing well in the virtual academy, how will the district help that student? Will exceptions be granted to go back to an in-person traditional school before a break? Since social distancing of 6 feet is not a concern for in-person, why can a student not switch to in-person before a break if it becomes necessary?
Social distancing is a concern for in-person and is being considered in all decision making. So just as if a student was not doing well with in-person instruction, the online teacher will be able to provide additional support to help that student progress.
Will parents have to wait for an all clear sign from the temperature check before pulling out of the parking lot when dropping off their student in the morning?
So we are still developing our drop-off plans at the schools, but those plans will include the parent waiting on the temperature check of their children.
What is the threshold of viral transmission that would lead you to decide to go back to shutdown?
So that would be a directive from the state health officials or the governor. It could be a directive of the health department depending on the circumstances.
When will parents know what teachers have been assigned to the virtual classes, as this may affect my decision?
Staffing decisions will be made based on the responses from parents. Staff cannot be assigned until we know the numbers for each re-entry option.
How will dismissal work in the afternoon? Normally car riders are brought into the gym sitting all together during dismissal. Is there another option? I'm sure the number of car riders will increase dramatically.
So the schools will be developing a dismissal plan. Yeah, that will follow the guidelines.
Will you be providing enough soap, hand sanitizer, and sanitizing wipes and equipment for the teachers to use all of the time? This includes for desks, etc., being wiped down between every class at the middle and high school level every day for an entire year.
So we have purchased and will continue to purchase the needed supplies.
What will the maximum student to teacher ratio be for option 2, Virtual Academy?
That's not yet determined, but going into it, our intent is to keep it at or below regular class cap sizes.
Was there any thought given to a soft opening similar to what Bowling Green Independent is doing?
Bowling Green Independent, as we looked online at their re-entry plan, did not adjust their opening day, their starting day of school. And so they are starting on August the 10th, I believe. So with our calendar adjustment, we felt like moving it back would allow us to start either in person or virtually based on the parent choice.
Will there be a midday temperature check? There will be some parents who will treat the fever in the morning with Tylenol. A midday check is probably a good idea.
So yeah, our plan is to do at least one additional temperature check later in the day.
Can we preview what an actual class or web setup will be like in Odysseyware? The preview on their website is pretty generic and doesn't provide a clear idea of what to expect. Will there be parent training on how to use it?
There will. As mentioned in the options provided, there are links to actual videos of the student experience, but beyond that, we do plan to have opportunities for parent and family training on how the virtual learning will be provided.
My question is concerning the scheduled week-long fall break in October. I feel like this could potentially cause an outbreak should families travel during this time and bring virus germs back to the school environment. I also believe that we should get as much face-to-face instruction before flu season begins, as many health experts fear this could result in school shutdowns. I have college students and have seen universities around the country plan for this by trying to complete in-person classes at the end of November. The current schedule for Woodford schools has our students finishing December 18th.
So based on the timing of the original calendar approval, we did not feel it was fair to remove a break from the calendar that many families may have already planned or have plans for.
Will curriculum be the same as last year?
We will continue to teach the Kentucky academic standards. However, adjustments will have to be made to establish pacing guides just based on the circumstances.
Many people with COVID do not have a temperature. Is a temperature check when students arrive the best or only way to monitor students?
Yeah, so that is the recommendation of the Healthy at School guidance.
If a child is in the virtual academy, can they still participate in band class and continue learning how to play their instrument either through live feed or other online means?
We are awaiting guidance from Kentucky Music Education Association in regard to music instruction. Regardless, it will not be able to be a live video feed.
Have you considered as a third option having an online academy with live teaching versus work at your own pace modules, which are not as effective for most students? Even a few days of live teaching with a couple of days of assigned work would be much more reasonable and would offer opportunities for a seamless transition from school to home if schools do have to close for a time.
So, just the way that we read this question, just wanted to clarify that a Woodford teacher will in fact be assigned to virtual classes and will be able to provide instructional support to the students.
Will you have substitute teachers come in for teachers who are sick? Are you in need of more substitute teachers?
So we would plan to have a substitute teacher come in for a teacher who is out sick. And yes, we are in need of more subs, as we always are.
What about extracurricular activities? If students are participating in school online, will they be able to participate in activities?
Yes, students will be allowed to participate in extracurricular activities if they are enrolled in the virtual academy, so long as they are passing their courses and meeting those eligibility requirements.
Will the desks be 6 feet apart in the school buildings?
So that will be determined by the number of in-person students.
How will self-quarantine work if a teacher or student tests positive? Will there be NTI work, or will students go into virtual sessions for the 2-week period?
So they will have an option to move to the virtual model or move to home hospital instruction for an extended time, which is more than 5 days. And the home hospital instructor would then be the contact with the student and set up the instruction.
How will in-person classes be split up in regards to level, low, average, advanced? We are assuming kids will not be switching between classrooms as had been done in the past for each level for reading and math. How will teachers meet the needs of all student levels within a single classroom?
It will, in fact, be the same base core instruction across the grade level. There will be opportunities for extensions to meet students' needs.
Do you have enough teachers?
Currently, we are staffed appropriately.
What have the risk assessments of the HVAC systems for each building shown, and what engineering and environmental controls are to be implemented to ensure adequate ventilation for in-person attendance? Has industrial hygiene testing been done to determine the air quality that the children and your employees will be working in? For those who would like more information, see the CDC guidelines for schools. Also, the OSHA guidelines for COVID-19 in the workplace.
And we are currently exploring any additional steps that may need to be taken. Our HVAC technician in the district is in contact with engineering groups to be able to seek options that we may need to look at.
So there will be absolutely no human contact for hours for my children. No hugging their teachers, no high fives, no sitting and whispering with their best friends.
So the recommendations we received are that we maintain as much distance as possible. However, peer-to-peer and adult-to-student interactions will occur to the extent possible within those guidelines.
Will school begin at 7:40 like all other previous years, or will new times be issued?
So all schools will begin and end at the same time as last year, except Safe Harbor, where a few minutes a day will be added.
Is there a possibility that my child's class will have 20 students, which cannot be 6 feet apart in a classroom, and my child will have to wear a mask the entire time in class?
Yes, it may be a possibility to have that many students in a class, and if students cannot be 6 feet apart, a mask will be required based on the Healthy at School guidelines.
What will recess look like for my children? Are children required to wear a mask during recess? Is every child supposed to be standing 6 feet apart? No running, playing ball, tag, or games of any sort?
This is a tough one. They can run while maintaining social distancing, but no tag. Games that maintain social distancing will be allowed. We're gonna facilitate collaboration among our teachers to brainstorm and get creative with some ideas.
Will hot food be served to the children?
Yes.
Will hallways be one way to reduce contact with other students?
So to the greatest extent possible, our hallways will be one way. There are some schools that have some dead-end hallways where that won't be possible.
Will children be allowed to bring lunch from home?
Yes, and we will follow any health department guidance related to the containers that need to be utilized.
How will middle school students transition from class to class? Will there be fewer students in the hallways and using lockers?
The middle school will develop a class transition plan that will minimize students in the hallway as much as possible. Locker use altogether is under consideration, and we will work with the health department and follow their recommendation.
Will only disposable containers be acceptable for packed lunches?
We have reached out to the health department for the answer to this question, and they are having to check to see if that will be necessary.
Since kids are wearing masks and there isn't a cap on the number of kids in a classroom or at a school, is there not a concern over social distancing?
So there is a cap on our class sizes. Guidance recommends that students be at least 3 feet apart if masked. Our plan is to maintain the distance recommendations with students since they will be in masks.
Will students eat in the cafeteria?
Our goal is to utilize the cafeteria for lunch. The cafeteria size does allow for greater social distance opportunities as opposed to a classroom. We will have to utilize seating charts in the cafeteria, so that would assist us in the need to do contact tracing, and it also allows our teachers to have their duty-free lunch.
98, so repeat. Will there be an option for students to eat lunch outside, weather permitting? Could there be separate, less crowded areas for students who want to bring their own lunches?
I think that can be considered, but with the contact tracing protocols, seating charts are necessary for us to be able to determine where students were during the day.
Will the pre-kindergarten and kindergarten classes be isolated from the rest of the school since those students will not be wearing masks?
So those students will not be isolated per se in a particular part of the building. However, our preschool students, our kindergarten students, they'll travel in the hallway. Their travel in the hallway will be staggered to avoid other grade levels as much as possible.
Can students spend more time outdoors than they normally do? Being outdoors encourages healthy living and strong immune systems and potentially allows them to have time without masks on, which these things are essential now. Since the playground equipment is off limits, will there be more outdoor curriculum and activities that kids can do?
In addition to the couple of responses I already gave related, teachers will monitor social distance while at recess, and as long as that social distancing is maintained, no mask will be required at recess.
What are the sanitizing procedures at the schools during the day and before and after the kids enter and leave? What about bathroom sanitation during the day?
We'll be working with our custodial staff to develop a cleaning schedule to be followed throughout the day.
Childcare can't be the main reason for in-person classes. Daycares only have 10 kids per class and are with the same group and teacher all day long.
Lack of childcare is not the only reason for the hybrid model not being considered at this point. It is a significant one, but there are several other reasons we feel this is not a viable option.
When would we know how many children will be in our children's elementary classrooms if we choose option 1, in-person school?
We will be asking parents for their decision on which option they will choose as soon as possible after the reentry decision is made by the board. Once parents have provided us their selection, we will then be able to determine the number of students that will be assigned to the virtual academy and to in-person instruction in each grade level at each building.
105.
Yeah, that's fine. Go ahead.
If a hybrid option is available, could we not have an in-house daycare option for our teachers since essential workers have been having this option?
There are a number of factors that would have to be included in housing and in-house daycare within our buildings. Number one, do we have space available in order to do that? Number two, can we find workers? Number three, I'm not sure we are in a position to be able to manage a wide range of ages. For example, if we had staff members who had newborns all the way up through 8, 9-year-olds, that would be difficult to maintain in a classroom within a building while school is going on.
Once a student has been exposed and asked to quarantine at home for 2 weeks, will the student be using the online format for learning or still staying connected with their in-school teacher via NTI? You mentioned during the board meeting that students bouncing from an online environment to an on-campus environment, or hybrid, would be too difficult. So I assume you all have a plan for the learning during the quarantine time frame.
In this scenario, home hospital services would be an appropriate option for a family to pursue, and that would allow for the student to remain enrolled in their in-person classes. And this would work by having a teacher assigned to that student who will work with the student to keep up with their assignments and their coursework.
I know there are many legitimate roadblocks with a hybrid method, but I feel that Woodford County is a creative and innovative enough place to figure them out. It is not safe at this time to allow full-time in-person classes. Yet it is unfair to expect parents to commit to an entire semester of no in-person help from their teachers. What happens if a virtual student falls behind and can't catch up to their peers when they are able to return to in-person school? Can we change the virtual commitment to 9-week grading periods? Can we add 1 day a week in-person day available for option for the virtual students who are struggling? Can we organize small group study pods for virtual students?
Virtual classrooms will have a Woodford County teacher to provide support to students, and those teachers will monitor individual students' progress and provide support as needed.
My son will be a senior in the fall, and he has signed up for a mix of AP, dual credit, and regular classes. If we opt for virtual school for the first semester, how will the dual credit and AP courses work? How will the re-enter potentially in January how will he re-enter potentially in January in the middle of those classes?
Edgenuity offers a number of AP courses, and we are looking at other online options as well. And then for dual credit, we will work with the universities to provide online options. Obviously, they are having more and more of those, but we need to take into account that may mean that they end up being in a course that includes college students.
Why is Woodford County the only school district in the area not considering a hybrid plan? Why do we only have 2 options? What happened to the every other day or every other week option?
We did consider a hybrid plan, but for a number of reasons, we don't feel that this is a viable option. Based on the results of our surveys, we felt the most viable options were offering parent choice for a virtual or an in-class model. We did consider a hybrid, but again, the logistics and the academic considerations for our students made it where we did not believe that it was a strong option to consider.
How is music education going to be modified in light of concerns about viral transmission from singing and woodwind instruments?
That is a good question, and we are waiting for final guidance as it relates to music classes.
Given the current state of Woodford County's internet reliability and accessibility throughout our county, would the school district have to provide hotspots or mobile internet from a cell phone carrier to those students that do not have access, either by geographical location or means of affording, such that they can participate in virtual learning? Would it also be a requirement of the school district to provide technology to the students for virtual learning should they not have access to it?
Yes, as mentioned before, if a Chromebook is needed, it will be provided, and then we will work with individual families if they are in need of internet access, case by case.
Are bus regulations going to apply to sports and band traveling to games and competitions? If so, are those groups going to have to pay for an extra transportation cost, or will the county cover those costs?
Currently, the transportation guidelines will allow for up to 2 students per seat with mask, and those guidelines would be followed on any trip, whether that be for band or for sports or any other extracurricular activity.
How will I know where my child will fall into a certain level based on the virtual learning classes? How will these compare to where they left off this past spring?
Students will be placed at their grade level, but we will be assessing early in the school year to determine any potential learning gaps.
As a working parent who could be called back into the office at any time, who would watch and educate my child while I work on their virtual school days? Can ETC handle that type of capacity? Where would we put everyone?
The way we interpreted this question, we did want to note that under the proposed plan, parents would have the choice of either in-person or virtual. In regard to ETC, that is an after-school program, of course, an option for in-person instruction.
How will the gifted students' needs be met?
Students individualized, they have what are called gifted service plans, will be implemented whether students attend virtually or in person. Our district gifted coordinator will work with our teachers to ensure those needs are met.
Who is teaching the online curriculum? The virtual online teacher or the assigned Woodford County teacher?
Well, the initial instruction, activities, lessons are through the online modules, but there will be support from the assigned Woodford County Virtual Academy teacher.
In regards to school bus temperature checks, if a child has a fever, what is the protocol?
If the parent is still present at the bus stop, then the child would be released back to them. However, if the parent is not present, we will do our best to isolate the child on the bus, and then they will be taken directly to the nurse upon arriving at school.
Why has the every other week in-person option been taken away as a possible way of reopening? If a class has 20 people in it, wouldn't it be better to have only 10 students there at once, alternating weeks?
Based on our survey results and the work that we've done, we felt the most viable options were offering parent choice for either virtual or in-class models. We did consider the hybrid plan, but for a number of reasons, we don't feel it is a viable option.
Okay, we've gotten through the questions that were submitted by the public. Do any board members have questions? Or do any of the cabinet want to expand on any question before we go into other questions? Anything you want to expand on?
And I think the questions that were submitted pretty well covered all of the other ones that we had received last week. As I reviewed that list, I don't know that there was anything on there that wasn't addressed with these questions. But if we missed something, certainly let us know.
Do any board members have questions?
Yes, I have a number of follow-ups, but I think Allison's talking, I'll let her go first.
Okay, Ms. Richardson, you go first.
Okay, sure. I was just kind of keeping up with the questions that were coming up on the YouTube feed as well. But a couple of questions that I had before I get to that is, this one addresses number 28. If a COVID positive test is found and students are quarantined in their home, will the parents of that student be quarantined as well? So if there's two parents in the home, that student has been quarantined to their home, are those parents quarantined as well?
That would be a determination from the health department, because they would be following their contact tracing protocols and make that determination. That would not be our decision.
How familiar are we with their contact tracing protocols?
Well, they will assign a contact tracer, and it will be their responsibility to determine who the close contacts are, and they will make the determination on who needs to be quarantined. That has nothing to do with us.
Right. No, I understand that, but it has a great deal to do with the parents who are at home. I know if my son is quarantined at home because a student or a teacher in one of his classes has tested positive for COVID, if he's quarantined at home and then my husband and myself both are quarantined for 14 days, that has a huge impact on families at home if two parents are stuck in their house. So whatever decision we make this evening, I would request that at least by the end of this week that we can address that question. I think that's very, very important for our community. They're going to have to decide, which one of these, whatever we decide we're going to do tonight, they have to decide what's best for their family. So if sending their kid to school is important to them, but then in return their kid is quarantined and both parents are quarantined, that makes a huge impact on a family.
Yeah. And it could be the other way too, that if a parent is quarantined because of something that happened at work, that child may be quarantined as well. And then we have to go through contact tracing with the schools. So, it goes both ways on that one.
Absolutely, but we're not making the decision for those parents. We're making the decision for our students right now. So if we could just get that information from the health department, I think that would be great. Also, who is the local pediatrician that you work with? I wasn't aware that we had a local pediatrician in Brazil.
I had one that, no, she lives here, but she works in Lexington, and she reached out to us to offer her services.
Okay. And what was her name?
Dr. Iddings,
Dr. Iddings, is that E-D-D-I?
Iddings. She's a
Okay.
Woodford grad.
Okay, perfect. Were any of the board members included in the meetings that you all had, the virtual meetings, the trainings that you guys took over the last week, after we decided to have this meeting tonight?
I don't know what you're talking about.
Were any of the board members included in any of those meetings to be able to address questions or be available?
What meetings are you talking me? We've had staff going through the questions.
There was a specific question, I think if you all had been in contact with, medical professionals, I think was the word epidemiologists, things, and you said that you've had several meetings.
57.
Those, we have a webcast from the Kentucky Department of Education every week.
Okay. So that's no. If the virtual only classroom is what we vote on tonight, I know that this question was asked but I don't feel like it was really answered. Someone asked, will ETC be equipped to be able to help these children when they're at ETC if they have two parents who work and the child is at ETC all day long? How are we going to meet the needs of those kids who spend every day in ETC all day long and it's a virtual only classroom, two parents working? Do we have any kind of way to help or assist those families who aren't going to have their kids in classroom today?
I don't know that we would, I don't know that we would be able to offer ETC if we are all virtual. That's something that would have to be considered.
Okay, and then the questions that I've been following on the live feed on YouTube, there's an anonymous teacher, and it just says, I'm not sure if it's really a question, but they're concerned with the fact that the survey that was sent out to teachers should be shared publicly so that people can see that the way the questions were written, and they want to know, I guess why the question essentially was just, will you go back to work? This isn't my question, I'm just forwarding these. Was there a more detailed question on how they expected reentry to look or would like reentry to look?
Garrett, you want to talk about it?
I'm assuming it's this question. Given the reentry options provided, will you be able to report for duty on site at your work location based on the traditional in-person model? Please note that this will include a requirement to wear face masks, daily temperature checks, and other safety recommendations.
Okay.
We had 89.
Another anonymous teacher, do you think returning in person is safe?
We are following the Healthy at School guidelines, and obviously the state health folks and the governor who have put those out believe that if we can follow those, that it's safe for our kids. And I think if we can follow those, it will be safe for our students. Does that mean that there will be no cases? No. Doesn't mean that. Just like we can't guarantee that nobody will get the flu or nobody will get a stomach virus or anything along those lines. But just as businesses have followed guidelines to be able to reopen safely, we've been provided guidelines for us to be able to reopen safely.
I'm sorry, just bear with me, I'm going through these real quick. Let's have one more, I believe. Come on.
Allison, do you want to look for that and let someone else ask their questions, or?
I found it.
Okay.
I'm sorry. I was
That's okay.
to order, but this one says, cleaning between classes seems unrealistic in terms of execution and in terms of keeping materials on hand in which to do that. So how do we, I know that we say that we are that we have everything ordered, but I know each year we ask parents specifically to send in wipes for tables, paper towels, cleaning supplies. Are we still going to do that this year, depending on which model we pick to go with? And if so, how do we determine that we're going to have enough of that every day, you know, for between classes?
We are working on a process for teachers to request items as they run out of the items for the cleaning, the purposes of cleaning.
I mean, obviously, it will be a challenge to try to stay up on those orders, but we will continue to place those orders as we have.
Okay, Debbie, I think that's it for me. Thank you. Thank you all for your answers. I appreciate it.
Okay, Ms. Bradley, I believe you had some questions?
For sure. I will piggyback on that PPE question. I mean, no one's able to get bleach wipes for their home. I don't think we can have a reasonable expectation that they can donate them to the schools. Do we have enough PPE to start all of our classrooms safely at this point?
I think we'll be able to start school. I mean, we will need to reorder as we go along, but we should be in a good spot when school starts.
Yes.
We do.
We believe we're in a good position to start school, yes, but we'll obviously have to continue to order things.
And do we know, are those items all available? I worry about things being on back order or, you know, the national delays that we are hearing about and seeing.
Yeah, we placed multiple orders over a month
Yeah,
ago.
we started quite a while ago placing orders, so we are in a good spot.
And those are coming in on time?
Yes.
Okay. On a follow-up about if the majority of students choose or parents choose virtual, I think we addressed that for certified staffing, but not for classified.
And
What would happen?
That would be dependent on their role. In some cases, as we've talked about before, we may have to assign an instructional assistant to assist with the virtual class. Other roles, I'll open it up.
Yeah, I'm not sure it would change. It wouldn't change anything for food service. Wouldn't change anything for custodians. Wouldn't change anything for office staff. We still would need bus drivers and monitors. So I think the vast majority of our classified staff would still be utilized in their normal roles.
Even if 80% of students chose virtual instruction, we would still require the same amount of staffing and everything?
At this point in time, you have to understand people are under contract.
Sure.
So, you know, we would have to put them to work and utilize them in the best way possible.
If 80% of our staff go virtual, then virtual is going to need some additional support. We're still, if 20% are in school, we're still going to have to run buses. We're still going to have to feed them. So we would have to come up with a plan for each one of those staff members.
Okay. On the question regarding the number of students in a classroom and when we would convey that to to parents, I guess my question is, when will we be able to convey that to our staff so that they can then make a decision about how they feel about their safety in returning? If I were a teacher and I knew that I was going to have 30 students in my class at the high school level, that's a vastly different decision than 10 socially distanced. I wonder how we're asking our staff to weigh in when they don't know the number of exposures they're going to have.
Well, and again, until we know numbers, we can't have staff weigh in. So,
but will we provide that option once we do?
I think we are going to find out from our staff what they are most comfortable doing based on the results that we get. We won't be able to get 30 kids in a classroom and keep them 3 feet apart. So again, we'll have to look at schedules and make adjustments to see what, if it's 30 students in an English 2, then maybe we have move some of those other students to a different English 2 class and only has 17 kids in it. So again, that's part of the nuances of the master schedule, particularly at the middle and high school, where you can make those adjustments and still provide students with the courses that they would like to take.
Okay, so you anticipate being able to accommodate as many students as want to come back in person if you have to make those classroom changes based on, if you have 30 kids that are in English 2?
There may come a tipping point that we can't, but again, we won't know that until we get the numbers.
Okay, and then once you have those numbers and you share them with parents, will they be allowed to change their mind if they don't feel safe with that number in a classroom?
If they want to go all virtual, yes, they can go all virtual.
Okay. On the question about busing seating for extracurriculars, are we then committed to having out-of-town travel for our extracurricular activities now?
Actually, the guidance that we've received so far has been to try to limit that to no more than potentially an hour and a half travel. But many of our competitions fall well within that range.
Did you? I'm sorry, Scott. My connection was a bit bad there. Did you say how far on the travel?
Typically, they've talked about no more than an hour and a half
Okay.
on the bus, and most of our competitions are well within that range.
Okay. On the sub issue, Garrett, I know in years past when we have had sub shortages, like you said, that is not a new thing. But commonly, if Mr. Hawkins' class wasn't covered, then you could pull his class into your classroom and cover a greater number of students. And I think that happens pretty frequently. What will we do to cover those classes when subs aren't available, knowing that we can't pull them into other classrooms and have more kids in a room?
Yeah, so a couple things I've done. We do have multiple substitute orientations later on this month, so we do have applicants, so we are going to try to increase our sub pool. But to answer your question specifically, and I've already started this, you can be an instructional assistant in our school district and be able to substitute in a classroom. So I trained one instructional assistant actually this morning to be a sub teacher as well. So if needed, we can pull other typically non-teachers, non-subs out of our building to help and assist in covering those classes.
Okay.
So trying to get some of our current staff in other roles trained to be a sub as well.
Okay. I will say on question number 37, in talking about how to clean between classes for the middle school and high school, I am really concerned about the responsibility or the onus being on a student to clean for another student. I think putting that expectation on kids is a big ask, given that as a parent, I know how my kids clean. I guess the question is that something that you are comfortable with, in an expectation that kids are going to adequately clean those surfaces and that teachers won't have to do that, while also monitoring class changes and making sure the kids in the hallways are social distanced and following the new pathways? That is a concern for me.
I guess I believe in our kids. And if we say this is really what we need you to do, I believe our kids will meet that challenge. And if we show them this is how you do it, I think they'll rise to that occasion. Maybe I'm naive, but I believe in Woodford County's kids that they'll be able to do that and do that well. So I think it really comes down to us being able to teach them how we do it and to be able to set those expectations.
Danny, can I just clarify real quick? I'm sorry to interrupt, but I just want to, just as a point, a question. Mr. Hawkins, are we asking the kids to clean the rooms and like the hallways in the schools, or are they just going to be cleaning like their desk as they exit?
It would
What
be-
exactly are you talking about?
It would be to wipe down their desk and their area before they would leave that particular classroom.
Okay, I just wanted to clarify. So you're just saying that as students leave, the teacher says, let's all wipe our desks down kind of
Yes.
thing, not a neat clean of the whole room. I just wanted to clarify. Thank you. Thank you, Dan.
Sure.
And let's try to let everyone get through. That's a good question, Sheridan. Follow up in our time. All right, go ahead, Danny.
Question number 71. I think the question asked the maximum student-teacher ratio for online instruction. Have you identified a maximum student ratio for in-person? Or are you going with the 3 feet of social distance space and using the calculator from KDE?
Well, I don't know that we'll use the calculator. I think we'll go into classrooms and we'll actually physically move desks to determine what that maximum would be.
Okay, and when will we do that?
Well, again, it would depend on the numbers to determine what can fit. I mean, we have looked and we believe that we can get students anywhere from 22 to 24 students in most of our classrooms and still be 4 to 5 feet apart.
Okay. On question 83 and several others regarding the quarantine procedures, how many home hospital or homebound teachers do we currently have?
Well, we had 2 part-time teachers, one has since retired, and so we are going to make the one home hospital teacher full-time. We do have some additional support with home hospital. We have some designated home hospital subs that can also help out, but we can always look at that staffing if needed. But currently we have one home hospital teacher.
Okay. I have a couple other questions that aren't necessarily on these. If you go into our schools and a lot of the restrooms have the push activations for the sinks, and I actually went over to the high school and did this. It took 11 times to get hot water. Do we need to consider changing out those faucets so that they can be turned on to allow for good hand hygiene and have hot water so that we're not having long lines in our restrooms and causing a bottleneck there?
We can certainly look at any adjustments that may need to be made.
Okay. And the one question that was, I don't know if it was asked, I was trying to keep up, but they were moving fast. Can you kind of explain what the Woodford County virtual teachers will be doing in a daily breakdown? If the question is, if they're not providing recorded instruction or live instruction as we are proposing, what are you envisioning that their role will be on a day-to-day basis?
We do envision that there would be some live instruction to support the Edgenuity or Odysseyware, particularly and to an increased amount at elementary and especially primary grade levels. So there will be live instruction provided. Beyond that, as the students get going through it, they're going to be monitoring their progress through Edgenuity, scheduling either small group or even down to individual live instructional support meetings over the course of the week. What our steps are once we have, if we move forward with that model, is to plan those sort of details of what a day-to-day may look like. But I certainly think if they are supporting what could be a whole class, that their day would be packed in terms of monitoring their progress and providing that support.
Okay. Brian, could you talk a little bit about how this will differ from NTI? I think a lot of people
Yeah.
are concerned that the online instruction will look like NTI at
Sure.
the end of last year.
Sure, and I also want to, with the options as they're presented right now, the document, I should say, that Ms. Bailey had put together, we've extended that. And in fact, created a chart that does exactly what you're asking. It has what Virtual Academy versus NTI. Some of the main things that we've already mentioned a little bit is NTI is short-term, virtual is obviously long-term. NTI was more so planned week to week, even day to day sometimes by those individual teachers or grade level teachers, whereas this is an online curriculum. Part of it is students moving independently through that curriculum. For example, both Edgenuity and Odysseyware are organized into units. So in any particular week or over the course of 2 weeks, the students will be completing that unit. And as I've already mentioned, the teacher checking their progress, scheduling those whole class, small group, individual meetings. So it will be, I guess the best thing I could say, it's already all laid out over the course of a long period of time, as opposed to what we did for NTI last spring. And again, that chart that we put together, and Elaine has titled it a toolkit, we're providing more of that information. Basically, it's a toolkit to help our parents make a decision.
Okay. I will wrap my time up, but I will also say that I think this is a big ask for our staff. I'm very appreciative of all of the work that the task force has done. I think that the feedback we've received has been invaluable, and I'm very appreciative of that, but I struggle given that we're sitting in a virtual meeting because we don't feel like we can have in-person meetings as a board, and it's 5 adults, with thinking that we should send little kids back in big numbers to be in a small classroom, and that they will somehow be safe if we are not. And Ms. Springate and I had a chance to go to a Kentucky School Board Association training this weekend, and that was held virtually because it wasn't safe to meet in person. I think this is a tough thing to ask, and I appreciate Mr. Hawkins acknowledging that at the beginning, and I appreciate all of your hard work and that of our staff as we get ready for school.
I think a couple,
Go ahead.
just a couple of things. I think number one, we can move back to in-person board meetings at any time at this point.
Yeah.
So it's just a matter of us figuring out how that needs to look, but that can happen. I think the second thing that we have to understand is that there are risks in both models, in both proposals. And to say that all virtual has no risk, it absolutely has some significant risk, both academically and from a social emotional standpoint. Does the other have risk? Yes, it does. And I think what we've tried to do as a staff is to say we understand there are risks. We believe it's very important for our students to be back in person in the classroom. And so what we've tried to do is put together a plan that would allow that to happen, but still give parents a choice on what they believe is best for their child and their family.
Thank you, Mr. Hawkins. Ms. Frigate, do you have any questions?
Yes, I just had a few things. First, I just want to say thank you, Mr. Hawkins, to you and the task force. It is so clear to me that you all have been diligent and that you have worked extremely hard on these 2 options for the 2-option model plan that you gave us. I did want to just say that I think that it's really important for us all to realize that no one knows what the future is going to hold with this pandemic. But I think it's clear in what you're saying that we need to plan so that we can have options for our students and our staff and our parents. And so in order to do that, we have to plan now. We have to decide now. that, people need as much time as possible, like you said, to change and accommodate if that's necessary. So to me, it's obvious that we have to vote for both options, because if we end up in August with no cases in Woodford County and, really no cases in Kentucky, and Kentucky by all metrics looking wonderful, and haven't planned for reopening, we won't be able to reopen, because there's still going to be all these precautions and these rules and these requirements. So in order for us to have that as an option in August, we absolutely need to be planning for that now. And I just appreciate that you chose two options that give parents the most control, the most choice. So if they choose in person, then they can choose that, and if they choose virtually, they can have that. And it sounds like you guys have really thought out and gone through these questions. I know there will be more questions, there will be more situations that pop up, but I do feel like that just with the expertise in the room and the work you all have done, that you're up for that challenge. So thank you all very much.
Okay, thank you, Ms. Springate. Mr. Wilson, do you have anything?
Yes, Scott, your group, thank you all very much for the work that you've done. Just a couple of follow-up questions. One of the opening questions was, and it didn't get into this detail, but today we had 576 new cases, which is the second highest since we've been counting, and the only higher day was when the Green River Correctional had a lot of positives to create the highest. One of the questions was, Mr. Hawkins, what's the difference now and then when we closed? And I believe you said the answer was, we know more about the virus now and businesses are open. Can you elaborate on that answer just a little bit?
Well, I think as we have learned more, and again, I think we understand more. I mean, why are we sitting in a mask today? Because that is recommended and it's a best practice for us to follow. We didn't know that in February and March. And so I think we are learning more and more each day. The fact that businesses have been given guidance to reopen and that not everything is still shut down, and at least the businesses that I have been to, it seems to be operating effectively. They're able to follow the healthy at work guidelines that were issued. And so the next progression was for healthy at school. And so we've been given those guidelines, and we have developed a plan that we believe meets those guidelines. And so I do think it's very different today than it was then. We're obviously testing a lot more people now than we were then. And so, again, I think there's just been a lot of additional information that's been provided and that we know now that's different. But again, I think we are following along in the progression that's come from the governor and the Department of Public Health.
Someone asked a question, what happens if more cases of the virus present themselves in our school? And I thought I understood you to say that the governor or the health department would make the decision to close Woodford County schools. Did I understand you correctly with that?
No, I think what we said was that if there was a directive for the state to shut down, like there was in March, that would come from the governor or from the Department of Public Health. If we had a number of cases that got to the level where the health department, local health department, felt like we needed to close, we would be working in conjunction with them on making that decision. But ultimately, they could say, I think we need to close right now. So that would not necessarily come from the state level in terms of just one school district. The state level would be more of a statewide shutdown, much like we saw in March.
But do we have any metrics for Woodford County regarding how many cases would there have to be to make that decision?
There are no metrics that exist. that would say if you reach X number, you are shutting down. At least not to my knowledge.
Is each building that we use going to have a health room with a private bathroom and an isolation room?
I don't know that every nurse's area has a private bathroom, but we do have an isolation room. We do have a separate isolation room in every school identified, yes.
What about the health room, though? That was one of the guidelines, one of the things that was suggested.
We don't have a private bathroom in each one of those. We do have one that's accessible that we currently utilize. I think the guidelines also said if feasible, that you would do that. But Kelly Simpson, our health coordinator, has gone around to each one of our schools and has worked with the building principal and the nurse to identify the needed space.
Okay, but could you put on the website which buildings will meet that requirement and which ones won't? About the health room with the private bathroom?
We probably want to check to make sure that that's something that we need to put on the website, or that we're allowed to put on the website.
Okay. So you'll take care of that then?
Yeah.
Okay.
Is there a reason that you feel that that's necessary?
I
Because
thought it was.
not all of our nurses' rooms have a private bathroom now, and we've never publicized that before.
Well, we're talking about parents making a decision about what's best for their children, and that might be one of the things. Is that called upon? Has the Department of Education suggested that?
That they have also said that if that's not there, you don't have to go and create it, because they understand that not every health room in every school across the state would have a private bathroom.
Okay, but it was suggested that would be helpful.
He said if you can do that, yes. If you can't, that doesn't mean it's not a health room or it can't be used.
How many bus drivers do we currently have?
I don't know that number off the top of my head right now.
Okay. Can you let us know that maybe at one of our other meetings?
Sure.
One of the critical components to make this work is parents having as much knowledge as they can have about to send their kids back to school or not, because there's a great deal of concern in the community about, do I send my children back to school, just based on the current environment, the current statistics in which we live. It's undeniable. So it's very important that our parents have as much information to make that decision. For instance, maybe I just didn't understand the answer, but there was a question about if a family doesn't have internet access, will the school provide internet access? And I believe the answer was we look at that on a case-by-case basis. But how in the world do people that don't have internet, how can you make the decision if you're going to do virtual or in person if you don't know answers like that?
And again, I think if just like we worked with many families back in the spring to help them with Spectrum, we will do the same thing again. If other avenues are needed, we do that all the time.
Okay, so
And
the answer would be
nothing
then.
is that we would work with each family on an individual basis to help them with internet issues that they may be having.
What's the timeline on the survey you've referred to several times this evening?
What do you mean, what's the timeline?
You said that you were going to have to do a poll to determine if people were going to do virtual or in school.
Yes,
Okay, when do you expect to do that?
we expect to get it out just as soon as we possibly can. I think it would be before the end of this week.
What information will accompany the poll? Will there be frequently asked questions? Will there be, if you have questions, call this number, that type of thing?
If I referenced before, you know, you've seen the options, the visual we had for that. That was, I believe, a 3-page document. We're up to probably 11 or 12 pages that includes that, as well as a lot of information we covered here today. Basically FAQs like you're mentioning. Again, it's called a toolkit, so it has as much information as possible for them to make that decision.
Good, thank you, Mr. Asher. One other question. You said something at the beginning about there would be no way to go all virtual at the beginning unless it was all semester. Did I understand you that correctly?
I said it would be very, very difficult to transition back to in-person before the end of the semester because students would be moving through the all virtual platform at individual pace. And so that would be extremely problematic and difficult to overcome because again, if I've got 30 students in a class when we all come back to school in October and they're at 30 different places in the sequence of the curriculum, that would be a challenge.
A parent asked me the question of if we did all virtual the first 9 weeks, that would allow us to better understand the direction that the disease is going. It also would allow students to still have your fall break, and it would give a 2-week quarantine time before classes started regarding people who may go to hotspots in fall break. What are your thoughts on that idea?
Again, it would be a challenge to be able to pull that off in the middle of a semester. Again,
but I mean, what about your thoughts about her idea about waiting 9 weeks? I know it would be difficult to pull off, but I'm talking about the positive aspects of waiting 9 weeks. Are there any in your estimation?
I would say that I believe it's important to try to get our kids back in the classroom. 9 weeks, if you think of it like this, would be another 2.5 months, and you add that to the 5 months that kids have already been out of school. That's a significant amount of time out of the classroom. Does it have merit to consider? Yeah, because a lot of things can change over a 9-week period. We may know a whole lot more, and we may not. Again, that's the thing that makes this so difficult, is there is no perfect model, there is no perfect plan. There are so many unknowns that there's no way to predict if that would be the right thing to do or not.
Are we going to another question? 2 other questions, and I'll conclude. And thank you for your assistance in answering these. Are we going to have any type of partnership with our health department or the public state health department to allow parents to have their children tested, the rapid test, if they are concerned about them going to school?
I will say we certainly can ask them about that. We have a great relationship with our local health department, and I don't know what they have available. And I don't know if those are being given through our health department or if there's another location where that can be done. But we can certainly reach out to them to find out the availability of something like that.
Okay. Then the last question, I had a question about a lot of the businesses that you made reference to being open and it seems to be successful. A lot of them have requirements to do, I don't know what the proper term, but the term I always hear is deep cleaning every day. Do we have any plans on doing deep cleaning each evening, maybe over the weekend, anything like that, or will it just be business as usual?
Or just what we're looking at as well.
The idea about the custodians changing it. So we have had those discussions. One idea that we've talked about that we are exploring is the potential of moving all of our custodians, even the ones on night shift, moving them all to day shift. So we would have all of our custodians in the building during the day when kids are in the building for extra support and extra cleaning. And then we are looking at multiple companies that provide disinfecting cleaning services. We actually had a meeting this morning with a company and have a couple more later on this week. And so if that works out, then we could have another organization come in the evening and follow up, you know, when kids are out of the building, when staff are out of the building, and follow up and do that disinfecting. And that would be daily.
You know, this is an observation more than a question. I'm very, very concerned about the employees that work in our buildings. We're giving parents and students a choice. We're giving them an absolute choice. You know the risk of coming to school. You know the risk of being exposed to 300 or 400 people in a building. And if you don't want to take that risk, you don't have to. You can be virtual. What type of assurances can we give our employees that they have a choice?
You want to talk through our process on that? I mean, through the survey results and then how we will handle that?
Yeah, so you know, our survey results indicated that by and large, the vast majority of our staff would like to return. But again, that was just a general, trying to get general information to help guide our planning process. I think once we get the results back from the parents, once we figure out how many students are going to go virtual, how many students are going to be in person, at that point we can get with our staff to find out specifically what they want. Find out if they prefer virtual, find out if they prefer in person. Find out what the variety of issues that they may have that may prevent them from coming back. So we will work with our staff to try to make sure that they are placed in the appropriate spot for them to be able to fulfill their contract.
And that will apply to both certified and classified?
Yes, sir.
All right. Thank you. Thank you all for your hard work and your efforts. This is not, you can't even use the word normal. These are definitely not normal times, but there's a lot of people in the county that have got to make some very difficult decisions, and there's no right or wrong answer. And I'm hopeful and I'm prayerful that this is successful. And thank you all for all your help.
Debbie, can I say one more thing?
Yes, ma'am.
I've been reading the questions that have come up over YouTube during this meeting and stuff, and this probably for me as a board member is the hardest decision that I'm gonna have to make so far. About our teachers who are going to have 15, 20, 30 kids coming into their classroom, and we're depending on their parents to make the right decision. And I know that we've all been guilty of our kids waking up with a low-grade fever, dosing them up with ibuprofen, sending them off to school. But this is a bigger issue. It's a scarier issue for our community, our students, our especially our teachers, because we expect them to care about our kids for 7 hours a day, 10 months out of the year. So if we choose option one, where parents can choose to send their kids to school full-time, or they can choose to do virtual learning, then we have to depend on those parents to make the right decision. If we decide to do the virtual only, then there's a group of kids, a large group of kids in our community. I mean, we have almost half of our kids are on free or reduced lunch in Woodford County. And we're leaving those kids with the possibility of not having a meal, the possibility of being in an abusive home, the possibility of so many things that we sit back and imagine is happening, but we are not really actually in that home. We don't see it happening. We don't know what they go through every day. And they need our teachers, and they need to be in those classrooms. But then our teachers have kids at home too. So I want to say that this is a decision that I don't take lightly. No matter what's said on social media, what anybody thinks about us individually over what we feel about the new school or anything else,
this is a heavy decision for all of us. And it hits home for all of us, especially if we live in this, I mean, we all live in this community and we see what goes on here every day. And so, I mean, the decision that we make tonight is going to be a hard one. It really is. And I appreciate the work that Scott and his team has done. I really do appreciate that. I've had email after email after email, and I'm glad, even if people think that, they're sending an email and it's annoying, it's not. I want to hear their voices. And so, the decision we make tonight, it's an important decision, and it's going to affect a lot of people. I'm glad that we got to have this. I'm glad we had this meeting tonight, even with 117 or 18 questions. I think it was very insightful.
Thank you, Allison. Anyone else want to have a little follow-up before I ask my questions? I just have a couple.
I did want to clarify one thing, Debbie. This is Sherry.
Sure.
Mr. Hawkins, I just want to clarify, you can't do the parent survey or really even survey the staff as to which option they want until the board makes a decision, correct?
That is correct, yes.
So really, the hold up to the planning and the surveying and the distributing the teachers and the figuring out how many people want to do each model, it's really all predicated on our decision. So we need to make that decision so that you can move forward.
Correct.
Thank you.
Okay, I just, to Sherry's point and some others, so much of this, as I listen to the answer, sounds like the chicken and the egg. Like, which has to come first? We have to let parents know what is happening so they can make a decision, but we can't make a decision until we know what decision they're going to make. And that's just kind of the nature of this that we're going to try to muddle through. So I think my questions are more, as I listen to the answers tonight, and this is not a criticism at all, this is just the fluid situation we're in. So many of them we're still looking at, or it depends on this, or it depends on that. So I guess my biggest question is, how are we going to make those decisions as we go forward? If we decide tonight for option one, there's still a ton of work for you all and for all of us. And first, I should have started by saying thank you guys so much that are sitting around that table. And also, thank you to everybody that's emailed and sent in. This is the most feedback I've gotten on anything since I've been on the board, and rightly so. This is unparalleled waters we're in. So I just want to use, there's some confusion about the task force, I think. It was set up with teachers, parent reps, and everybody. And I thought the task force was going to do the reentry plan, but then I became aware from an email from Mr. Hawkins that they mainly worked on curriculum. And I can see why that was so, because we were waiting for the governor, and that didn't happen until July 1st. So it kind of came up to the cabinet to make this reentry plan. So you said you were going to open the task force again. So you're going to do that and then kind of maybe involve them a little bit more deeply in this reentry and some of these questions that come up.
Sure.
As we, when we figure out our numbers, that's going to lead to 10 more questions. So this is going to be constant decision making.
So, if I may address that, just the task force and cabinet/admin, we're gaining all perspectives. So let me first start with the task force. It was all about what supports are necessary for reentry. And based on that initial work, which has all the representation that you mentioned, we fell into 3 categories of what types of supports. Academic supports, social, emotional, mental health, and then our special populations, such as our gifted, our special ed, so on and so forth. So we planned the supports that we could at that point in time. So like our summer learning, things like that. What we need at this point is what our reentry plan is, and then what supports are necessary for those reentries. At the same time, and all along, informing them of the logistics, the information coming in, getting their feedback, all that perspective, to then take back to our admin team, which would include all the folks you see here at cabinet level, as well as our school leadership. And we met weekly. We set a schedule where every Monday we were meeting and just constantly updates. It was new information each week. So it's a combination of those two, mainly those two things, as well as the number of surveys we did to put together this reentry plan. So I could not, I kind of disagree what you said just a little bit, is that it wasn't
Okay.
one group forming that reentry plan. As you could tell what I described, multiple perspectives, multiple degrees of work went into that. So
Okay, well, thank you for clarifying
Sure.
this, Director. I know Mr. Wilson had asked that the task force be videotaped, and then there was an email where it was like, well, they're only looking at curriculum. So that's where my confusion came, and thank you for clarifying that. And also, I'm glad the schools are involved, because in all this decision, it seems like each school may be different, depending on their numbers. Like maybe Huntertown will have these classes outside in this area, and Northside will maybe not. So it really seems like in communicating to parents, we have to have some of these things outlined at a school level so that parents can look at their own individual school and see if that's the choice they want to make.
Yep.
So again, tonight is one decision that's just going to set off lots more decisions. And I would ask, and we can get this down on Monday, that at least one board member, maybe two, joins in on the task force as well as we do it, as we go forward. And obviously the main partner we need, and I know she couldn't be here tonight, is the public health director in Woodford County. She's on vacation, and good for her. I'm sure there's nobody in Woodford County that needs a vacation more than her right now. But the more answers we can get from her for our parents, and maybe have her work with our task force, I think the more informative we're going to be able to be with our parents.
Well, and I think so many.
Oh, go ahead.
So many of the things, and we saw those questions over and over again about
Sure.
the quarantine. What happens if we get a case? I mean, at the end of the day, the answer is we will be working with our health department in every one of those situations. I can't give them a number. I can't tell them your student's going to be quarantined because you happen to be in the classroom, because that may not be the case.
Sure.
It depends on if they are identified as a close contact. And, you know, what we have been told is that the key is these things right here. It's the mask.
Yeah.
And the more that we are in the mask, the more protected we are from the virus. And I think it lessens the likelihood that you might be a close contact. Doesn't mean you wouldn't be, but it would lessen the likelihood. And so, I think, and I understand parents want to know that. What I just can't give them a more definite answer on that, because we don't know we haven't been through a contact tracing process, so we don't know what that looks like.
And if we could get her involved a little bit with some of this communication, she may not be able to give that answer either, but she might be able to give a little bit more about what goes behind that decision, or just some kind of information. That's what I know we've been working with her as a partner, and I know she's busy, but
Well, Garrett read
her biggest
right
challenge in Woodford County is going to be opening these schools, so she might want to, be able to kind of help us communicate some stuff to the parents more than we can, even if there isn't a definitive answer. So that's all I have. I want to thank you guys again.
Ms. Evelyn,
Yes, ma'am.
can I interject while we're on the task force real quick?
Yes, ma'am.
Can we go ahead and expand the task force moving forward and include more teacher representation, and try and get at least one representative from each of our stakeholders in the district? Get a bus driver involved and someone from an office staff involved.
Well,
but most
it's a different-
importantly, can we involve more of our school nurses if they are able, so that we're getting the biggest and best knowledge pool we can on that?
So the bus drivers, those aren't the supports that we will continue to plan with task force. They will be involved on this side when I mentioned the admin who are dealing with logistics and safety. Does that make sense? So,
Well, I guess, are you planning to have two task forces then for reentry, one focused on the
I think it's
actual
just
logistics?
I think we'll have multiple groups working. I mean, transportation's going to be working on their deal. Food service will be working on theirs. How we handle the students coming into the building, that's going to be completely separate. I mean, so each area is going to have to focus on theirs. Otherwise, the task force has a specific job. And I think if we start bringing in groups that aren't a part of that job, I mean, because we're talking about planning professional development for teachers. That doesn't impact the bus drivers. That doesn't impact our school nurses. Now, is Kelly working with our school nurses on things? Absolutely. She's talking with them on a weekly basis, if not more frequently than that. So each of the groups is working on their part of what this reentry will look like. There's no way one large group could tackle all of those pieces. That's just not logistically possible.
Okay.
Okay, who is on the task force right now, and what is their main focus at this moment?
Well, I won't by name, but we have myself and Martha co-chair that. Mr. Hawkins sits in. Ms. Francis, excuse me, is part of that. At the school level, we have a number of teachers. We have school administrators. We have a school counselor. We have parents.
EL.
Yes, our ESL teacher, who is also our district lead on that. Our gifted coordinator. Help me if I'm leaving anybody.
Reading specialists, primary, intermediate teachers.
Yeah, and as far as teachers, all levels represented when you consider primary, intermediate, middle school, and high.
Administrators, counselors.
Said all that.
You have a couple of parents, I believe.
Yeah, I mentioned parents.
Right,
I said
yep.
parents.
Oh, okay, I didn't
So-
hear.
We structured the
And so
test.
are they working on, things like, are we going to be able to socially distance?
No.
Are we going to be, they're not working on any of these like nuts and bolts
No.
of this reentry plan?
Mm-mm.
That's the cabinet, is that correct?
The cabinet, the administrative team, I mean, that's,
But if I could explain one connection on that, because they do
Okay.
overlap, because they're going to have those concerns. Mr. Sprinkle from our middle school, he's on the task force, and then of the subgroups I mentioned, he's on the social, emotional, mental health group. He brought up something in regard to educating our students about COVID-19, about social distancing. So it's related, but not necessarily the logistics of it. It's related
Yeah,
because
they were looking at the logistics, which most of our questions tonight from the public were really about the logistics, the safety preparations. There were some curriculum and educational too, but there were a lot more about that. So I was just wondering, so that's pretty much the cabinet with input from other entities. Is that correct?
Well,
Is that a good way to say it?
it's really the full administrative team, because as you said,
Including administrators from the schools.
yeah, I mean, because each of the things that they're dealing with are going to be very unique to their school. So we will say that they're going to have an arrival plan. It might look a little different from Huntertown to Southside to Northside
Yeah.
to Simmons. So
Exactly.
what we
And I
do
think-
is that we, and Ryan coordinated a meeting with the elementary principals last Friday, just to start talking through some of those things, and they were bouncing ideas off of each other on how they make that work. So
Great.
that's part of this whole process moving forward, up until the first day of school.
Yeah, and beyond. Okay, I want to thank you guys so much. I'm telling you right now, I've gotten a lot of emails. There's a lot of very ingrained desires and opinions out there, and they're all valid, and there's no good answer. I think Mr. Wilson said that, but hopefully we'll come to the best answer. So I appreciate your work. If there's nothing else, we'll go to item 4 on the regular agenda, which is
Hey, Debbie, I just want to go back to the poll that's going to go out
Okay,
at the end of the week. And I'm asking that there be information, like if you're the parent of a special needs student, if you have a question, call blank blank at this number. you have a question about, there just needs to be information on this poll where people can reach out to get a quick answer regarding an individual need. Does that make sense, Superintendent?
Yes, we were planning on sending a cover letter with the email, and we can certainly put some contact information in there with the people from the different departments to be.
Perfect.
Now again, I don't know that we can answer transportation questions yet, those kinds of things, but if it's about
But if someone has a question about internet, someone has a question about a special needs virtual instruction.
Sure.
Someone has those type of needs.
Sure.
Those type of questions.
Sure.
Okay.
We can do that.
Thank you. Thank you. Thank you, Ms. Eva.
Okay. So if there's nothing else, we'll move on to, on our regular agenda, determine reentry model for 2021. So let me make sure that we're clear on what we're voting on. Option 1, Mr. Hawkins, jump in if this is incorrect. Option 1 is that parents would be given the choice of an all virtual or an all in-person. That's option 1, right? The parent choice, I think we call it.
You may want to say proposal 1 because in the plan, it lists option 1 as in-person and option 2 as virtual. So you may want to just call it proposal 1 is the dual system parent choice. Proposal 2 is all virtual.
Okay, so do I have a motion to adopt the proposal 1, which is the parent choice model? There's dual options for parents to choose between. That's all virtual or all in person. Do I have a motion?
So moved.
Do I have a second? I'll second that motion. Is there any discussion? Okay, let's vote in person. Ms. Bradley.
I'm sorry, just 1 second. I did want to just clarify in discussion, Debbie.
Yes.
What you said at the beginning, Mr. Hawkins, that if situations change, if the positive cases were to skyrocket, we can always move to an all virtual option, but we can't always move to a dual option because there's planning and logistics that have to go into that. Is that right?
That is, I don't want to say you can't completely not go back, but it would be extremely difficult to try to change back unless you did it before the end of July. And I don't know that you're going to know that much different in 2 weeks. So yes, to answer your question.
I'm just clarifying that if something, if we were to see a terrible rise in Woodford County, we always have the option to move to virtual if that's the safest thing for our staff and students.
Yes.
Okay.
Any further discussion? All right, Ms. Bradley. I'll call the roll for voting. Ms. Bradley.
Aye.
Oh, I'm sorry. I thought you were saying aye, and then so you're voting yes.
How would you like me to vote?
You're voting yes, right?
Yes.
Okay. Ms. Richardson.
Yes.
Ms. Springate.
Yes.
Mr. Wilson.
Yes.
And the chair votes yes. So the motion passes 5-0 to adopt the reentry plan proposal 1, which is the dual plan parent choice between virtual and in person. Okay. I think the next thing on our agenda is motion to adjourn.
Just discussion, you usually ask for discussion. One of the things that I would like to...
Okay. We don't have to, go ahead.
One of the things I'd like to say is we have 3, maybe 4 board meetings before August 26th. I would hope that the main topic of conversation the main topic of our time, the main topic of our energy and our dialogue with the superintendent and his staff could be on safely reopening our school.
Okay, thank you.
Yeah.
And I'd like to second that, what Ambrose said.
Okay,
Because I do worry about our teachers. I have a knot in my stomach thinking about them right now. And I will be like a bull in a china shop, making sure that our school district is doing everything possible to make sure that our teachers are safe, that we do what we have to do to make sure that they feel comfortable.
okay,
We're entrusting our children with them. So I just want to make that very clear, and I agree with Ambrose, this needs to be the topic of discussion.
I agree. All right, do I have a motion to adjourn?
So moved.
Second.
We have a motion by Mr. Wilson, a second by Ms. Springate. All in favor say aye.
Aye.
All opposed?
Thank you. Bye.
Thank you all. Thank you, Elaine, for your emceeing.